everybody. Thanks for sticking with us today. And Dr. Chu, thank you to you and the MedX team for putting together an excellent conference. I didn't really know what to expect coming here. I looked at a number of the videos online and got to speak to some people, and it's really exceeded expectations. And it's really amazing to come together in a group of people who have a mind and a vision for the future and about transforming healthcare and transforming medical education and healthcare education. The first thing I want to mention is like what I was taught is that when you're in a new space, a new land or a new area, you're supposed to acknowledge the original inhabitants of the area. And so is there anybody here from the Muwekma Ohlone community? Okay, so the tribal community that is from here is the Muwekma Ohlone folks. And they still live here, and their ways are still here. They still speak their language, and I humbly ask their permission to speak here, even though someone is not here with us today. Without further ado, I'd like to show you some pictures and tell you some stories. Right here, this is a photograph of myself on the left, and on the right, that's one of my relatives. Strange as it may be, like my wife and I, we've been able to go and collect images, either from private collections of photographs, family collections, or from museums of our family. And this photograph right here is one of the earliest photographs of someone in my family. This is actually that I have. This is my great-grandma. And this is from the Dakota Territory around the turn of the century of the 1900s. And she, like many Native youth, were forcibly removed from their homes. And so my great-grandma was taken out of her home and not raised by the family starting at a very young age. She was actually raised to be a nun, and that didn't work out. But she grew up in that era when education was a means to removing you from your culture. It was the vehicle by which we were separated from culture, language, customs, extended kinship, that family structure, the core of what held us together. And so this picture to me, it's an interesting photograph in that it's right at the precipice of when my family went from speaking up to potentially 4 languages down to speaking 1. And I don't really know how the education system went for her. And kind of the black box about this photograph for me is, what is the expression on her face? Because in my mind's eye, like I want to imagine her as a young, happy, joyful little girl who's learning stuff, who's, has friends. But then on the other side, I really don't know, right? So it's like, is she experiencing the hardships of this, or is she experiencing some benefits from this? And so when I look at this picture, there are way more questions than there are answers for me with this picture. But that just gives a brief step and just a quick glimpse into the challenges that we from American Indian communities face when we encounter the educational system. Because it was used to take what was dearest to us and try and extract it. I don't think it was successful, but there was definitely damage that was done, okay? Going into my journey in medical education, I think there's some nuances that happen, and there's some parallels to her experience, because I think that the experience that American Indian experiences in medical education, it's a culture that is vastly different from your own. You go from one side, which has extended kinship. It's got like these tight family bonds where elders are revered and respected. You do not interrupt people ever. Okay? To a system where you introduce into this medical education system where over here, you compete in two things. You compete when you're fighting for your life, and you compete in sport and games, okay? Whereas like over here, you start competing with people on the individual level to try and get into school, okay? You start being rewarded for the behaviors that weren't who you were taught to be, okay? Are you inefficient or are you efficient? If you interrupt people more in the medical education system, maybe that's rewarded because then you're someone who's efficient, who can extract information quicker. Maybe you don't listen as much, right? So it's these kind of things that were a challenge. Now let me just tell you a story about when I started to become a little bit, like I really think this was the pivotal event in why I went down this path of trying to improve Native health and wellness through the recruitment of American Indians to the health professions, physicians, dentistry, nurses, pharmacists, the gamut, social workers. I was a third-year medical student working in northern Minnesota. I grew up around Bemidji, Minnesota in the summers. It's the small town that's in the heart of the three largest Minnesota Chippewa reservations. And I was selected to be a student that was out there, my third-year medical student for a year. It was amazing to go home, to be able to have lunch with my grandma, okay? To be able to go and interact with folks from the community, to reconnect with people that I hadn't seen for a while. And March 20th, 2005, I was one of the medical staff for the Cass Lake Bena boys basketball team. Basketball on the reservation is it's life, okay? It is like religion. Like there is family and then there is basketball. And the Cass Lake Bena boys that year had gone to state. We went down to state. We had, McDonald's High School All-American on the team and things like that. It was exciting, okay? But we didn't make it into the championship game. And everybody's like, okay, fine. And we played the last consolation game right before that on the way home was to be third, okay? And most everybody said like, well, the tribal team's gonna give up. They didn't get to the distance, they're just gonna give up. But they didn't. The guys battled and they fought and they won. And the reason it was so important to us because someone at that time from a large paper in the Minneapolis-St. Paul area was writing an article about the lost youth of the Leech Lake Indian Reservation. Yet to us, this was so different. We were able to accomplish things together. We were able to celebrate as a community about the team and everything that was happening. And you're talking like, you get back to town after taking, like we took third, and that was a big deal. But you get back to town at 2 in the morning, and like the sirens are going and the lights are going. And that's exciting. Just went to bed all excited that night. Woke up the next morning, go to the hospital. Very next day, does anybody know what happened in Red Lake in March 2005? Anybody? There was a school shooting the next day. Whereas one of the kids from the community, decided to take the life of his grandfather, go to school, take the life of the security guard, shoot a number of the students and his peers and his classmates. And as a third-year medical student, I was in the emergency department that day. I went from this day where it was just like really exciting, you have this triumphant experience. And then the very next day, you face true tragedy. And about that, looking back, I was the only Native person that I can recall that was in the ER that day. Like looking at these family members like down the curtains and just seeing like, oh yeah, that's the uncle of someone who hung out with my uncle and they taught us this. And on Wednesday nights, we used to sing songs, with him leading it, and like, his nephew's on the other side of that curtain. That was hard, okay? But I realized at that moment that something had to change. We had to be included in the health education system. Like, we were gonna be able to make change if we were present, okay? At the same time, I was able to meet someone who, I'd actually met him a long time before that. His name was Tommy Stillday. And he was a leader, a spiritual leader of our community. We've got what are called Mashkiki and Nini, which are like the people who know the plants, so like the plant medicine people, okay? But he was the Anandawayanini, okay? Unbroken lineage of people who led the Grand Medicine Lodge for our community. This goes back thousands of years. And we became very good friends during this time because we both happened to escape the situation at the same time. We went up to a language camp because we just needed to get out of the environment of what was going on. I was working in the hospital dealing with the fallout circumstances. He was the one who was overseeing burials and rites for those things. But we formed this really tight, close bond in that experience. This is Tommy, and I finished out my third year medical school, finished out my fourth year medical school, and then I went ahead and went off to residency. I checked in with him frequently. And I could tell maybe that I was calling less and less, calling home less and less as I was going from this side of my life, going into more of the urgent, impatient, rushing side of my life. Maybe not listening as much, maybe taking on some characteristics that were different than I was taught. One day I get a phone call, and I was talking to him a little bit, and he just said real plainly, I was second-year resident, I was in my clinic, he's just like, Eric, I need to teach you some things. Come to Red Lake. I'll see you when you get here. Click. And it just like woke me up, okay? I had been so consumed in my training and getting into that realm and just trying to be the best doctor I could that I started to ignore feeding some of those parts of my life and the culture. And it just woke me up. I walked down the hall to my residency director. I said, I gotta go home. He was just like, okay. What do you mean? I was like, old man called me on the phone. He said, I gotta go home. So I gotta go home. He's like, when? I said, now. And I love the Seattle Indian Health Board residency for this because they understood where I was coming from. And so I went. No plans, no nothing. And I went and I showed up and I got up to Red Lake and I was all excited, okay? I was going to learn some things from him. He was going to teach me some things that he had to teach me. Great, I was all excited. Get up there, ready to go. Get there, okay, let's learn, let's do stuff. I've got about a month, they're going to let me off. Let's learn some stuff. We didn't talk about anything. But how's your family doing? You know, let's go over here, let's go visit with some folks. Do you want to go get coffee? Do you like corn soup? Right? Until the fourth day, I was sitting there and I was like, you know, Tommy, let's go over to the cut and let's watch the sunset. It was like end of the fourth day, the sun was going down. I just felt I was starting to relax a little bit. And right then, as the sun went down, he just kind of looked at me and said, okay, now we can teach you some things. But your mind was too busy. It was too distracted. And you wouldn't have heard a thing I said if we would have started earlier. So now we can start. That's that cultural divide between this world and that world that oftentimes in medical education we're expected to kind of straddle, okay? And it's hard. This is the status of medical school matriculants broken down by race and ethnicity over the course of about the last 35 years. If you look at, and Native Hawaiian brothers and sisters, forgive me for not including you guys in here. This is from the AAMC data. Whereas every other major racial and ethnic group in the minority category has increased since 1980, American Indians are actually declining. There are fewer American Indians who are going into medical school now than there were in 1980. Now there's 147 schools. I don't know how many there were in 1980, but it's a big difference. What is more is the trend that has happened since 1996. 1996 was kind of a bumper year for our communities, where things have been moving up and there are centers of excellence and there are more and more students. But since that time, there's been a 70% reduction in American Indian applicants and a 63% reduction in American Indian acceptees. Think about this. There are over 88,000 medical students in this country right now. AAMC put this out recently, a graph, snapshot, chart. Over 88,000 88,000 native of just medical students. There's just barely over 200 of all years of medical school are American Indian now. That blows my mind. Because you would think that there'd be a way that we'd be moving on a positive trajectory with the work that we've been doing. There's a lot of work to be done. The thing about that, if you look closely at the chart from the AAMC, is that there are a few schools that are kind of carrying the torch for this. And you know, if there's folks from like multiple medical schools that are here, we need help figuring this out. There are about 8 to 10 medical schools that consistently graduate all the medical students. University of Washington, Oklahoma, New Mexico, Arizona, Minnesota, Wisconsin, OHSU. 50% of all American Indian medical students right now are concentrated in 5% of medical schools. I'm trying to figure out how to help and to work with the other 141 medical schools to try and increase our presence in the schools. Because if you look, people say, well, there's a lot of, you know, that's where American Indians are. They're in New Mexico, they're in Arizona, they're in North Dakota, they're in Minnesota. American Indians by numbers are mostly in New York, LA, Houston, Chicago, okay? I think there's a discrepancy in the numbers there. This is how I see making a difference and how we can work together. Most oftentimes people are identified way too late, more at the application phase to school, whereas we need to be identifying students much earlier. Because without a number of natives in health professions, Native youth aren't going to be seeing who they could become one day. Which led me to We Are Healers. How can we work, if there's so few of us in health professions, if there's so few of us in academia, to try and increase the presence of American Indians in American Indian youth lives? So what we did is we developed We Are Healers, a nonprofit organization, has 3 main aims. Inspire American Indian youth aged 10 to 24 to pursue health careers. Connect those youth with enrichment programs and mentors. And then the third thing is to assist and advise academic health centers in how to identify, recruit, retain, and train American Indians. This right here, to me, is how we're doing this. Because we can't get out to rural communities, we're using digital media to reach out. Lakita is a young woman from a community back in Wisconsin. And this video is targeted specifically to students who are 10 to 16. So would you be able to show a video real quick? Thank you.
Dear Native youth dreaming of college, I know how hard it is to imagine yourself here. I doubted my dreams too. But my grandma encouraged me. You can do it, Lakita. You can go to college. I listened to her, and I followed my dream. The first in my family. But getting here was just the beginning. I missed home, classes were hard, and I felt like everyone else knew what they were doing. but that made me work harder. People began to believe in me, and I believed in myself. And despite all the challenges, I dreamed even bigger. I dreamed of becoming a doctor. If I can, you can too. Follow me. Follow your dreams. You can go to college. You can become a doctor. One day, you could take care of our elders and our families and the next generation. We believe in you. Lakita Malson, class of 2020, University of Wisconsin, School of Medicine and Public Health.
At We're Healers, we have a number of these videos. Right now, I think we're approaching 15. And if you are at an academic health center, or if you're someone who supports the idea of increasing and including American Indians in the health professional education system and the US medical education system, be it as a supporter, as an educator, as a foundation, and as an innovator, join us. We're going to move the needle on this. We're going to partner with people across the country who focus on efforts with Native youth. We're going to work with the best enrichment programs around the country. We're going to help in ways that we can and partner together to collaborate and bring about a big change for Native youth. And it's not just about the kids. Like, this is about our elders. This is about our family members. You know, someone once told me, they're like, Eric, it's so noble what you're doing working with American Indian people. It's like, you know, there's nothing noble about it. It's personal. It's one day, I'm gonna go home, and I'm gonna be the person living on the res, small little cabin somewhere. And I wanna look back in the face of an MA, and then a nurse, and a doctor, and a pharmacist, who that maybe we touched along the way somehow. Because I believe that having us in the health education system brings about an opportunity for students who come with very unique experiences to add to the collective voice to improve and transform healthcare for all. This feather here, this was given to me by the very first Native American medical student who was a male that I ever met. It was a huge day in my life. June 5th, year 2000. I'd met Native women who were physicians and nurses before, but I'd never met a Native man before. And the same day I met Native male medical student who was from my tribe and Native male physician. This feather was given to that medical student by the very first American Indian to graduate from the Mayo School of Medicine. It's a chain, it's a lineage that keeps being passed on, passing that torch of trying to increase the number of us who join and are included in health education. We have this word in my tribe. It was on the first slide, and it's Mama Wichigewin, which means we do things together. We do things as a community, not as individuals. When you accomplish a big task, you do it as a community, as a group. Mama Wichigewin, as the MedX community. You are all here for a reason, and I think it's because you want to transform health education. You want to transform how patients experience medical care. You want to transform how health is delivered in this country, whatever that means. It's really exciting to be here with this group. And I want to close with honoring of MedX, all of you that are here, and the group of people that make this possible. Amanda, will you join me up here? Dr. Chu, will you join me? Like I said, we do, go ahead and stand on my left here. We do things together as a group, all of us. And we balance things. We have the male energy, the female energy, to bring about a good way to what we're doing here. What an exciting time and an exciting conference to be at. I'm going to ask you guys to stand and join us as we celebrate what has gone on here today. I want you guys to think about that one thing that you can do when you leave here tonight, when you leave tomorrow, when you go home. Like, what is that one thing you're going to do to transform in your life to bring about that change in healthcare like we're talking about? Be it education, be it your clinical practice,